And there we go. Again, good morning to everyone. I'm Jim Pressman. I'm going to be your host today. Jordan Earl is with us. She is a licensed social worker from the VA who's going to share with us a lot of the information that she knows about some of the programs that are available through the VA. And she has a slide presentation that we hope is going to give us a lot of insight into many of the programs that are available through the Veterans Administration, especially in the healthcare side. Jordan is not part of the Veterans Benefits Administration. Also, though she may have a little bit of information there, it's more in the healthcare side of things. So we want to keep that that kind of clear. Also, because of Jordan's presentation, we're not able to see the entire screen as we normally do. So we would like to ask if you have any questions to withhold them until the end of Jordan's presentation. And with that, Jordan, welcome. We are the TMA Military Veterans with Myositis group. We are the absolute, the global center for information exchange for any veteran with inclusion body myositis. And so with that, the screen is yours. Thank you for joining us.
Okay, thank you, Jim, for the introduction. First off, just housekeeping. Can everybody hear me and see me okay?
You seem to be coming through fine.
All right, very good. Things happen with technology, as we know. So if that changes, just holler at me and I will know. So again, thank you for the introduction. I am very grateful for the opportunity to be here to share some of my knowledge that I've learned. As Jim said, I am a patient-aligned care team, PACT, social worker, which is really just another way of saying primary care team social worker at a VA hospital. I am by no means an expert on any of this information. I have been with the VA, however, about 2.5 years. So during that time, I've learned quite a bit, and I'm hopeful that what I've learned during my time will be of benefit to you all. I work in a particular PACT team called the Advanced Care Clinic. So we work specifically with veterans who are 75 years of age and older, and they have very unique healthcare needs and challenges. Just a disclaimer, there are quite a few slides in this presentation, so bear with me, we will get through them. There will not be a test at the end, but my hope is that it can be a reference for the future that you can refer back to and utilize. As we know, as you know more than anyone, the VA is a very large and very complex healthcare system. And with that being said, it can be very overwhelming, especially to not only veterans, but their family members. So my hope today is to illuminate and provide some knowledge on some programs that may be helpful to you. So we will start with the basics. What is PACT? When you sign up for VA healthcare and choose your main VA location, whichever one is closest to you, you'll be assigned to a healthcare team. Again, it's called a PACT, very similar to a primary care team. And your team will be made up of you, those who support you, such as your family members, your caregivers, spouse, and your healthcare provider. So very important to keep in mind that it is the patient-aligned care team for a reason. And so at the center of that care team is the patient, the veteran. And who is on my team? Very similar to a primary care team, you have your provider, your primary care provider, whether that be a doctor, physician's assistant, nurse practitioner. You have a registered nurse who is a case manager who oversees the veteran's care and works with the primary care provider. We have a licensed practical nurse, an LPN, who does a lot more of the legwork in terms of nursing, providing vaccines, collaborating with the RN and the rest of the health team. And then we have the clerk, and the clerk is one of the most important positions in the entire team, because this is the first face that you see when you come into the clinic. And they help with scheduling, they help with getting those messages that you need to get to your doctor, to your nurse, your social worker. So they are a vital part of the team. Social workers, such as myself, whole health coaches, mental health providers, pharmacists, and dietitians are also part of the team, and they're available if you request them. And again, at the VA, we take an approach that puts the veteran at the center. Research shows that this kind of approach leads to better quality of care. And I always like to say the veteran is the expert on themselves. So it only makes sense that the veteran is at the center of care. What do we mean by that? What matters to the veteran and his or her healthcare is what needs to matter to us as the primary care team. My job as the PACT social worker is to be a link to the healthcare team, often referred to as kind of the hub of all resources VA related. So each day is a little bit different. You never know what you're going to get, but some of the duties are communicating with agencies in the community to bridge gaps between the VA and the community with a goal of partnering. So there are a lot of resources that have not been tapped into, not because they're not available, but because veterans don't know about them. So we're here to be a bridge to that gap. We do complete psychosocial assessments to evaluate needs, risk factors, support system, different resources and things that play a part in a veteran's overall health. We do advanced directives, so living wills, releases of information, which if you have not completed a release of information, just a plug for that. It's very important that you do so, and you can get with your social worker and do it. It goes right into your VA chart. I just convinced my own dad to do one recently. He's a Vietnam veteran. But the benefit of that is if you lose the ability to provide verbal consent to speak with your spouse, your loved one, that release of information says that as of the date that it's signed, until the date that it expires, you are providing consent for the VA to speak with your partner, whoever's on the form. And contrary to what a lot of people believe, even if you have an advanced directive and you've identified a healthcare agent, that healthcare agent's authority only takes effect if and when you lose capacity. So having the release of information is another beneficial part of making sure that your family is able to communicate with your VA team. We do a lot of, especially in my clinic, end of life care planning discussions, goals of care, identifying what's the most important to the veteran and the family. As Jim said, we are not the VBA. That is sometimes a source of confusion, but the Veterans Health Administration, which is where I work, abbreviated VHA, is very different than VBA, Veterans Benefit Administration. We do work hand in hand with them, and we can provide contact information and general guidance, but we are separate. So topics such as service-connected disability, non-service connected pensions, which are based on time served and income, aid and attendance, survivors benefits, those are all some of the benefits that we may discuss and get you connected with a VSO, a veteran service officer, to apply for. We also provide support to caregivers, family members, financial aid, food assistance, transportation, resources, a lot of housing, housing needs, homelessness. As we can imagine, if a veteran is not sure where they're going to lay their head at night, making it to their doctor's appointment is not going to be a priority. It's going to have to go on the back burner because we're focused on survival. So looking at those sort of things, those social determinants of health is what we refer to them as, those factors that have the potential to influence a veteran's health, their well-being, and consequently their access to healthcare. All right. We also do assessments for iPads that allow for video call capabilities, reducing that barrier to care. And this is really important for veterans that may be housebound, that are not able to physically come to the VA, but they want to connect with their providers over video, or maybe engage with Whole Health over video and do some of those programs and groups and classes. So if a veteran does not have internet access, there are some low-cost resources that will get them connected with if they don't have a computer or iPad. And if they're unable to afford it, if it's beyond their means, then that's something that we can provide. We get a lot of legal questions on elder law, guardianship, housing. So we can provide some information on that. And then, as we said, reducing housing instability. I don't know who all on the call is in Florida, but we are now in hurricane season until November. So we are starting to have emergency preparedness planning discussions. If you do live in Florida and you haven't had that yet, I encourage you to have it. But it's one of the things that as PACT social workers we do. The biggest thing is assisting veterans and their families with navigating the VA. That in itself is very challenging. And one of the best parts about my job is being able to do that, to hopefully simplify what seems overwhelming by breaking it up into smaller pieces that are understood. And then we partner with veterans to identify and work toward desired changes related to holistic wellness and quality of life. Some of the high risk areas that we do work with are things such as abuse, neglect, exploitation, intimate partner violence. Working in the advanced care clinic, we are faced with memory loss and changes to mental status quite frequently. And there are tools that we can use to assess cognitive changes. Unfortunately, as veterans age and as they are also faced with different chronic health conditions, they need more help. And so we look at what are those tangible sources of support that we can put into the home to try to keep veterans at home. So we look at levels of care, substance use, frequent hospital admission or emergency room visits. These are all high risk situations that we do see on a regular basis. So now that we've talked all about a PACT social worker, how do you contact your PACT social worker? A lot of times I hear a veteran say they didn't even know they had a social worker. And it's one of those scenarios where you don't know what you don't know. So your PACT social worker is available. They would love to speak with you. I'm going to just speak for them and say that. But any veteran, family member, or caregiver can contact a social worker. All you have to do is find out who is your assigned PACT doctor. And if you don't have a PACT doctor, you're considered an unassigned veteran. So that is as simple as contacting the eligibility department of your local VA hospital or community-based outpatient clinic and saying, I want to get established with a primary care team. Once you do that, the whole world sort of opens up in a sense, because then you have access to your social worker, to the other disciplines that we spoke about earlier, and they can work for you and with you to try to get you the benefits that you need. Veterans Benefit Administration. I put a phone number here where you can call to get connected in order to ask those questions related to service-connected VA pension, the PACT Act, toxic exposure screenings. You can also contact your PACT social worker and get a list of VSOs, veteran service officers in your area. And there's a My VA 411 information line. So I encourage you to save this PowerPoint so that you can go back and reference it. So now getting into some of the programs that may be of need to you. Program of Comprehensive Assistance for Family Caregivers. It's a mouthful, but it's abbreviated PCAFC. That's how you may have heard it. And this is for the caregiver. Although caring for a loved one is in and of itself not a burden, it's a privilege. We know that the emotional, physical, and mental stress that comes with it can be overwhelming and can be very detrimental to a person's well-being. So we did create the caregiver support program in hopes of reducing some of that caregiver fatigue and burnout.
Jordan, if I may interrupt, please forgive me.
Yes.
But I wanted to just announce that I will have a copy. Jordan has provided the slides to us, and I can forward those to everybody. So you don't have to work to copy down information or make notations, because I will have that information. And after the meeting today, within the next 24 hours, I'll try to get that disseminated to everybody. So I just wanted to make it known that I'll have a copy of those slides that Jordan is providing, and I will share them with everybody. Jordan, thank you. Please go ahead.
Perfect. Thank you, Jim. Yeah, no one needs to be feverishly writing. This will be available to you. So the PCAFC is one of two caregiver support programs, but it is the one that most people care the most about. And that is because it does involve a monetary stipend for the caregiver. So eligibility, a veteran has to be 70% service-connected disabled, meaning they have a service connection disability that is a result of their time in service. And they have to have a need for personal care services, meaning they need someone to help them with bathing, with dressing, with getting, preparing meals. And they have to require, if they don't need necessarily the physical help getting in and out of the shower and providing personal care, they need supervision in order to carry out those tasks of daily living, activities of daily living. So service connection and require that assistance. To qualify as a caregiver, what does that look like? You must be at least 18 years old, and at least one of these must be true for you. You're either a spouse, son, daughter, family member, some type of extended family member. So you have a connection to the veteran and you live full-time with the veteran, or if you don't live full-time with them, you're willing to move in with them. The benefit of being a caregiver, as we said, is a monthly stipend that can go towards the cost of caregiving. It's extremely expensive to provide some of the needed services that are available. So that monthly stipend is designed to alleviate some of that financial strain. And then the primary caregiver may have access to healthcare benefits through CHAMP VA if they don't already have another health care plan. There is an opportunity, if you have more than one caregiver, to identify a secondary family caregiver. And in doing so, that gives them additional education, training, resources that would otherwise not be available to them. If you or someone you know is interested in applying for PCAFC, the quickest way to do so is by going online, and I have put the link in the slide. But if you're not super tech savvy, which is okay if you're not, there is a way of completing a hard copy application and mailing that in. So 2 ways of applying. There's a phone number that a veteran can call, or family member if interested in completing it and need some help completing it, the application itself. There's also a caregiver support coordinator locator, which is really cool because it will help you find your caregiver support coordinator. And that person is someone that can walk you through, how do I apply? Do I qualify? And what are some of those benefits that are available to me? And there's another link as well. If you don't qualify for PCAFC, there is another program within the caregiver supports, the general caregiver support services. It's not as much of a fan favorite because it doesn't include the stipend. However, it is equally as important. It's a great program for family members that are struggling with caring for their loved one, that are really doing the best they can, but they need some additional support. There's mentoring, there's skills training, there's online programs and coaching. A lot of times caregivers, especially if their support system is limited, they can easily feel very isolated. And that in turn affects their ability to care for the veteran. So this program is available. General caregivers do not need to be a relative or live with the veteran. It could be a neighbor, it could be a friend, someone who is caring for the veteran and needs support. That's really the only criteria. Every VA facility should have a caregiver support team as well as a caregiver support coordinator. So calling that number that we identified earlier or going to that website will help you identify who that person is. So if you're interested, I do suggest reaching out to that person. There's no application for the general caregiver support program. There are some steps here that are recommended. Reach out to the caregiver support coordinator. They'll do an intake with you over the phone, not to weed you out or determine if you're eligible or not, but just to get the ball going. The veteran will need to agree to receive care from the caregiver and to have that person listed in their electronic health record. Veteran-directed care is a good second option for veterans that don't qualify for PCAFC. This is a program that gives veterans the opportunity to receive at-home services with the goal of staying at home. There are some circumstances, of course, where a veteran does have to go into a facility, whether temporarily or long-term, but the goal, if it can be accomplished safely, of many families is to keep the veteran home. So veteran-directed care is a program that was built out of that desire, and it gives the veteran the choice and the control to hire a worker, manage that worker's time, and they're assigned a monthly budget based on the veteran's needs and functional limitations. One or more of the following must apply. So you have to have that dependency with 3 or more ADLs. Again, personal care. Significant cognitive impairment that leads to dependencies for ADL. So it may not be physical. It may be something cognitive wise that renders you needing that support. And there are a list on the right-hand side of different ADL dependencies that they're specifically looking for. Multiple hospitalizations, living alone in the community, being considered vulnerable, recent discharge from a nursing home facility. Those are all factors that are considered. I will say that recently, veteran-directed care, the guidelines have become more stringent in that they are looking for more activities of daily living, whereas it used to be three. In my area, at least, I'm finding that the veteran is needing at least 6 to 8 activities of daily living assistance in order to qualify. And the reason for that is budget related. But one important thing to keep in mind is VDC does replace other VA services. So we'll talk about some of these in a moment, but adult day, respite care, homemaker home health aid, HHA, all of those services go away once a veteran is enrolled in veteran directed care. And it is a very formal arrangement. It actually involves identifying an employee, a caregiver. This is someone who's willing to be paid to provide personal care services to the veteran. They actually receive a W-2 each year. You also have to have, in addition to the employee, an authorized representative. And this person is someone who, typically it's the veteran, if they're of cognitive capacity to be able to act as the representative. And if not the veteran, then they can identify an alternative person, but they're the ones that are responsible for managing the program. So hiring or terminating the employees, determining an hourly wage, reporting hours worked. You have to be able to go online, either with a computer or smartphone, and enter hours into this online payroll database. And from there, funds are filtered through a payroll agency, and a check is received 2 times per month. So this is awesome for veterans that do want to stay at home. Maybe they have a spouse who is providing wonderful care to them, and they want the opportunity to have that spouse compensated. It can seem kind of daunting at first, but once you get set up and enrolled, there is a background check. I didn't mention that. There's a background check process, but it can be a very beneficial program. How do you apply? Like many of these things, you need to start with your PACT social worker. You may have to complete what's called a PMR, physical medical rehab, OT functional assessment, to determine if the ADL requirement is met. So that's one of the first things I look at if a family is interested in VDC. I'll look in the chart and see, did they do a PMR OT assessment recently? If not, let's get them set up to do that. There may be with VDC a $15 per day copayment after the first 21 days. So first 21 days are free. Day 22, there may be a copay. How we determine that is it's called a 1010 EC form. And that's something that you would complete. It asks questions about your finances, and you turn that into the eligibility office. Another tidbit of information is that if a veteran is considered catastrophically disabled, they may not have a copay. So that factors in as well. A link there at the bottom. Aid and attendance. So many of you have probably heard of aid and attendance. It is a very, very popular benefit, and it is a monthly payment. It's a monthly amount of money that is added to a veteran's pre-existing pension or service-connected disability compensation. Surviving spouses and dependent children may also be eligible for aid and attendance or survivor's pension. There are quite a few different factors that are evaluated for that. So to learn more, the best thing to do is get connected with the VBA or VSO. It's based on things like time served, duration of time in service, and income, as far as the surviving spouse. For the veteran, in order to be eligible, you have to meet at least one of these requirements. You need another person to help you perform activities of daily living. You have to stay in bed. You're confined to the bed because of your condition. You are a patient in a nursing home due to the loss of mental or physical abilities related to your disability, or you have vision impairment. Housebound is similar to aid and attendance, but it's different. And one consideration is that a veteran can't get aid and attendance and housebound at the same time. It's not an and, it's one or the other. So housebound is for veterans that, as the name implies, are housebound. So they receive a VA pension and spend the majority of their time in their home because of a disability. They're designed to help permanently disabled veterans receive the care they need while they're confined to their houses. To receive this pension, the veteran must have a single permanent disability that has been evaluated as 100% disabling, confines them to their home, or may also render them bedridden. To apply, there is a form called the 21-2680 form, and your social worker can provide it. There's a few different ways that you can turn that form in once it's been completed. You can mail it to what's called a pension management center for your state. You can drop it off in person at your local VBA regional office. Or again, what I recommend is you can actually sit down and meet with a VSO. The benefit of meeting with a VSO is they are very well versed and very knowledgeable when it comes to benefits. So they know certain buzzwords and things to put on the application that would otherwise make you eligible. They know what is being looked for. The form itself does have to be completed by a physician. So there's information that you put on the form, your demographics, but then the physician has to complete their part, which is speaking to your need for assistance with activities of daily living, and they sign it. You can also include with your form when you apply medical records, details about what your day looks like that requires you to need assistance, anything that will help prove I need aid and attendance. This is actually something I learned of recently, but if you're in a nursing home and you're applying for aid and attendance, there's an additional form that you have to complete, the 21-0779. And that is in a couple of slides. I put a link there. But one thing to keep in mind is that it can take up to 6 months for an aid and attendance determination to be reached. And so that can sometimes be worrisome for a veteran that is in an assisted living or another setting where they need additional income. So my suggestion is always, if you think you're eligible, if you're starting to require that assistance with activities of daily living and you think that you may need additional income, that is the time to apply, not when you're at the point of financial crisis and really needing it. And it's available. It's available to veterans that meet the criteria. So some resources here, the different forms, how to find your local VA, pension management center, and evidence that you'll need to support your claim. If you're not really sure where to start, that's okay. The best point of contact is your social worker. They can get you a list of the VSOs in your area. Okay. We're covering a lot of ground. Is everybody still with me?
We are.
Okay. All right. Homemaker home health aides. This is free of cost to veterans and is essentially a medical assistant who can come to the veteran's home and help them take care of themselves. You have to need assistance with activities of living, at least 2. It's not a registered nurse, but it is someone who's supervised by a registered nurse. So home health aides work for a community agency that has a contract with the VA, and there's a list of different ones that each VA is contracted with. Hours vary based on need and are usually in 4-hour shifts. So my experience has been a veteran may be approved from anywhere from 6 hours a week to 20 plus hours a week. And that's broken up by those 4 hours. In our area, it may be different in other areas, but in our area, the agencies will not do less than 4-hour shifts, and they don't break those up. It's 4 hours at a time. So if a veteran is approved for 16 hours a week, 4 days a week, 4 hours at a time, you just need to ask your PACT doctor for a consult. For those veterans that need a little more assistance than what the home health aide can provide, maybe they do need help with bathing, dressing, and toileting, but they also would benefit from having a nurse come out, a nurse that can check their vitals once or twice a week, that can help them with medication management. Skilled nursing also encompasses physical therapy and occupational therapy. It also includes wound care. So
All right, listen to me very carefully. I'm on.
Getting some feedback. I think there's a hot mic. Okay.
Yeah, we got that taken care of. Go ahead, please.
Okay. Skilled nursing, 1 to 2 times per week. This is not designed to replace long-term care placement. It's not an everyday visit. It's once or twice per week. But some of the services, as we said, skilled nursing, case management, PTOT, speech therapy, wound care, or IV antibiotics. And the good thing about this is it can be used in combination with other resources. So a veteran can have simultaneously home health aides to help with personal care and skilled nursing. We see this a lot when a veteran gets out of a rehab facility and is transitioning home and still needs some help with physical therapy to regain some of their strength, to reduce falls. This is a good resource. Adult day. Sometimes veterans will, and actually the name is adult day. Daycare is how they refer to it. I don't refer to it as adult daycare. It's adult day healthcare. And it's a program that is the equivalent of a senior center. It's a place that veterans can go in the community to be around other peers, many of which are veterans themselves, can receive companionship, recreation, and it's for veterans that need help with activities of daily living that would otherwise not be, it would not be ideal for them to be left at home alone without supervision. Another big selling point of adult healthcare is it can provide respite for the family and can also help veterans gain skills to manage the veterans' care at home. A lot of these facilities will provide transportation, so you don't have to worry about that. Lunch is provided, there may be snacks, and they have different activities, different guest speakers, different things that they offer based on location. But if interested, the process is to reach out to one of the VA contracted adult day facilities to schedule a visit. Sometimes they'll refer to it as a friendly visit, and to complete that 1010 EC form that we talked about earlier to determine if there will be a copay. Again, it wouldn't start until day 22, but if there was, it'd be $15 a day maximum. One thing I do want to make sure I mention about adult day is veterans that are unable to ambulate. If they're not able to, not ambulate, but bear weight. If they're not able to at least bear weight and stand, that can sometimes be a deterrent that would make them not the best candidate for adult day. A second category of veteran that would not be the best candidate is a veteran that has significant dementia to a point of having wandering or exit seeking behaviors. And the reason for that is safety, of course, limitations of the staff. So those are some factors to consider. One thing that people often don't know, and I have this conversation regularly where a veteran will tell me they just purchased a power chair or a wheelchair. And the reason for that is they didn't think the VA could provide it. The VA can provide durable medical equipment, canes, walkers, wheelchairs, power scooters, shower chairs, anything you can think of really that has to do with home safety, the VA can probably provide it. If a veteran receives a wheelchair, or a power chair from the VA, they also may be a candidate for a wheelchair ramp. Continence and personal care supplies, those Depends, personal care wipes, may not sound like much, but it adds up in terms of financial burden. So the VA can provide those if asked. Wheelchair lifts, sometimes for vehicles and for homes. I've known veterans that have had a lift going from first floor to second floor. Medical alert bracelet for those veterans that have certain conditions, dementia, heart conditions that they would want someone to know. There's a medical alert bracelet where it would have their address, their name, and those conditions listed right on the bracelet. That's free of cost. A medical alert necklace or bracelet, one of those life alerts of fallen and can't get up, those are provided as well. It'll be shipped right to your home. Respite care. This is a program that is designed to give the caregiver a break so that they can leave the home with peace of mind, knowing that their loved one is okay. They can run errands, they can go get their hair done, something that they need to do for them, or they can go in the other room and take a nap. Again, with pretty much all of these programs, the criteria is standard, that there's going to be a need for assistance with activities of daily living. There are two main types of respite care. There's home respite care and nursing home respite care. Home respite works very much like home health aides do. It'd be a contracted agency in the community that would come out to the home for a certain number of hours per week so that the caregiver can leave. Something that a lot of people don't know is the respite care workers are not there to provide personal care. They're there to provide respite care. However, if personal care is needed, they can provide that if it's requested. There's also nursing home respite care. And this is for veteran families. They have to go out of town for a week or two. The veteran requires some help, some supervision, and they're maybe not comfortable leaving them at home alone. There is a contracted list of nursing homes, skilled nursing facilities in the community, and a family is eligible for up to 30 days in a calendar year. It's up to the family how they want to break up that 30 days. If you want to do all 30 days at once, you can. If you want to do a week at a time, 2 weeks at a time, you can. Maybe a copay. Veterans who are CAT disabled should not have a copay. And I always recommend with that, go tour the facilities. Don't schedule an appointment. Show up. Show up, because that's when you're going to get the most realistic idea of what the facility is like. Transportation. There are many different programs for transportation. I almost didn't want to talk about it because it varies so much. But just to give you an overview, beneficiary travel is a resource that's available to veterans. And within beneficiary travel, under that umbrella, there are more nuanced programs. Special mode is also referred to as wheelchair transport. And this is a transport option that can accommodate wheelchairs. It can accommodate veterans who have vision impairment, who have dementia, who need that transportation. A good thing about it is they can also have a caregiver come with them, a family member come with them. Uber Health, I don't know, in all transparency, if this is something that's offered in other VAs right now. I know it's a pilot that we're doing at our local VA, but it is for veterans that don't meet the criteria for special mode and can still get in and out of an Uber, a taxi. It's paid for by the VA to transport veterans to and from VA or community care authorized appointments. Mileage and per diem, there can be reimbursement for food, mileage, and accommodations. And in some situations, there is availability of flight, the cost of flights to be covered. I see that a lot with transplants. Special mode, you may be eligible if you have a service-connected rating of 30% or more, or you meet the income criteria. That income criteria is determined if you receive a VA pension or if your income does not exceed the maximum annual pension rate. So that sounds very confusing. We determine it by doing a 1010 EZR form. So if you say, hey, I'm not 30% service connected, but I am on a very fixed income, I only get Social Security, and transportation is a barrier for me getting to my VA appointments. Maybe you have transportation, but you don't want to burden your caregiver, your loved one who also has their own medical appointments that they need to get to. This may be a good program for you. There's also a possibility of having special mode transport approved for compensation and pension exams. But the main criteria is income, wheelchair bound, cognitive impairment, or vision impairment. You can ask your doctor or your social worker to enter a consult. When scheduling, you need to call the VA travel office within 3 business days. Those requirements, again, may vary by location. This is how it is for our VA. And consults are usually approved for either one-time use when a veteran is being discharged home from a hospitalization, 1 month, 6 months, or 1 year. And that's determined based on need. HISA grant. This is one of those tomato. Some people will say HISA. I personally say HISA. But this is a grant that the VA provides for medically necessary improvements and alterations to a veteran's home. I come across veterans that very frequently struggle to get in and out of the shower because it's a step-up tub. So the HISA grant may give them the opportunity to have that changed from a step-up tub to a walk-in shower. That's just one example. Some of the other things that the HISA grant can accommodate are allowing entrance to and from the residence. So if there's steps and a veteran's wheelchair bound, you're not really going to be able to get up the steps. So ramps can be put in place, roll-in showers, allowing accessibility to kitchen or bathroom sinks, so lowering sinks so they're more accessible. Improving entrance paths or driveways to facilitate access to the home, and improving plumbing or electrical systems. This is designed to maintain as much independence to the veteran as possible. Things HISA will not cover: walkways to exterior buildings, exterior decking, building new construction, or spas, hot tubs, jacuzzis. The amount that is approved through HISA is determined on service-connected disability. So up to $6,800 may be approved if the modification is needed on the basis of a service-connected disability. If the veteran has a service-connected disability at least 50%, then they may also qualify for that higher amount of $6,800. $2,000 may be approved for veterans that need modifications to their home, not on the basis of service-connected disability. All HISA projects must be medically justified for the service-connected disability and or non-service-connected disability. And how we determine that is the PACT doctor will enter a consult to OT to determine that eligibility. So sometimes I will come across veterans that will go ahead and do the home modifications, and then they'll request reimbursement. My recommendation is to go through the steps. They're there for a reason. So reach out to the PACT doctor, get the OT consult in, and you can also contact your prosthetic or sensory aids department to find out more as well. Community nursing home, abbreviated CNH. These are skilled nursing care facilities in the community that have contracts with the VA. These are for long-term care. So veterans that are no longer safe to remain at home, or they don't have a support system that can care for them to the extent that they need it. So to be eligible for a VA contracted community nursing home, a veteran must have a service-connected disability rating of 70%, or this is a loophole, 60% and unemployable. So if you're not 70, but you do have that additional unemployable factor, then you may be eligible. So these are veterans that require skilled nursing level of care, that are looking for long-term care, and that meet the service-connected criteria. And if so, the VA will cover the cost of it. Community care network. This is the short-term care version of community nursing home. So these are also skilled nursing care facilities. They do provide skilled nursing care, but it's for short-term care, such as rehabilitation. Again, you have to be 70% service connected or 60 and unemployable. And the PACT social worker can help you determine which level of care you're needing and if you qualify. It is subject to nursing facility availability. So sometimes there does require some patience while we wait for a bed to be available. Assisted living facilities. The VA does not cover the cost of assisted living facilities. This is often a source of frustration and misconception. I wish that we did, but we do not. The VA does not cover the cost of assisted living facilities. This responsibility, unfortunately, falls on the veteran and their family. There are some veterans state homes throughout the state and in multiple states that are funded through, in Florida, it's funded through the FDVA. And those offer assisted living level of care as well as nursing home level of care. They're great facilities. One downfall is that they are often not in close proximity. In our VA, the closest one is Land O'Lakes in Orlando. There's one in North Florida, right outside of Lake City. So another benefit of the state homes is they will accept veterans regardless of income. A downfall is they often have waiting lists. So veteran state homes, just keep that in the back of your mind. That is always an option. But if you're looking for an assisted living facility and you need some help paying for it, there are ways to supplement income. Aid and attendance is one that we talked about, and Medicaid long-term care. I'm not going to say too much on Medicaid long-term care because I know just enough about it I'm definitely not an expert on it. However, if finances are a barrier to assisted living facility placement and you are under a certain income threshold each year, then you may qualify for Medicaid long-term care. Some of the veterans I work with, they don't have any other option. They have to apply for Medicaid long-term care in order to fund going into a facility. It is income-based, and in Florida right now, that limit is for a single person, 2,829 per month. So no more than 2,800 in income and no more than $2,000 in assets. If you are above either of those, then you wouldn't qualify. There are what's called aging and disability resource centers. And these are the one-stop shops for Medicaid long-term care. They're very helpful, and they will do phone interviews to determine if a veteran is eligible, or non-veteran, to determine if a person's eligible and get them on a waiting list. The waiting list is based on need. So veterans that are more vulnerable, that have limited support systems, they will be placed on higher up on that list. The limits do change, so you need to check in on a pretty regular basis. And community agencies that assist with applying, there may be some additional ones in your area. Here we have the Area Agency on Aging. Medicare Advantage plans are also a good thing to consider that goes beyond just the traditional Part A and Part B. You'll hear it sometimes referred to as Part C, or an MA plan, a Medicare Advantage plan. So Medicare does not cover the cost of long-term assisted living facilities. However, some Medicare Advantage plans pay for related services. So Medicare Advantage, Medicaid long-term care, I do recommend that if you're considering any of these, it's a good idea to talk to your local aging and disability resource center. And especially when it comes to Medicaid, to consider talking with an elder lawyer, someone that specializes in elder law, to make sure that you're making the most informed decision, not only for you, but for your family. Financially, how is it going to affect you and your family if you do apply for Medicaid long-term care? Those are some of the questions to consider. Some links here for learning more about Medicare, a link for elder lawyers. This is for the state of Florida, but that'd be a good place to start to ask for legal resources in your state. And then a breakdown of the Medicaid long-term care process. VA healthcare eligibility. So maybe you're a veteran or you know a veteran who has not accessed VA healthcare before. Maybe you are not sure if you qualify for VA healthcare. The VA has come a long way in terms of repairing our relationship with veterans and rebuilding some of the fractures in trust that have been created historically. If you have not accessed VA healthcare, I encourage you to look into it. And if you've had a negative experience with the VA in the past, I understand. And if it's been years, I encourage you to give us another chance. Hopefully we can rectify some of those negative experiences. But typically, if you served in the military, in the active military, if you were in naval or air service, and you were separated under any condition other than dishonorable, you may qualify for VA healthcare. So if you're not sure, apply. You can learn more about it by going to this link. You can apply online, you can apply by phone, you can apply by mail. There's many ways to do so. So I just clicked on the link. Well, this is what it looks like. If you go to the link, apply for VA healthcare, you can actually go through the steps here? Okay. You can also apply in person. You can go through the state's Department of Veteran Affairs, and you can apply with the help of a trained professional, a VSO. There's some links there. So that brings me to the end of the presentation. One thing I do want to put a plug in for really quickly is, with all this talk about Florida and hurricanes, we are recommending that now is the time that you're starting to consider, what's my emergency plan? Is there a need for a special needs shelter? If you do have those more specific medical needs, those registrations have to be completed yearly. So it's not a one and done. It has to be completed yearly. Considering things that you may not consider normally, a backup generator in case of power loss, having enough non-perishable items, medications in case you are housebound, you're not able to leave, oxygen tanks. Shelters are, as the name implies, a shelter, so it's not the most ideal scenario, but it can be life-saving if needed, and there are transportation that's offered to get to and from the special needs shelter. And with that, I'm going to stop talking. I appreciate everyone for hanging in there with me, and I'm happy to try my best to answer any questions that you may have.
Jordan, we thank you endlessly for your for all of this information. You have opened the eyes, I think, of a lot of us on what these programs are and how what they're available. Honestly, I was not even aware that some of these programs existed, and they're important to me. And I'm going to definitely look into a couple of them here, especially the respite care. If my wife has to do anything, she is my angel. She is the one who takes care of me. And if she has to go do anything for leave, for any period of time, it's nice to know those services existed. And that is exactly why we wanted you to help us understand these things. And you did a wonderful job, and we thank you immensely for all of this information. Again, if I don't know if I can extract these slides from the PowerPoint presentation, but if you can send them to me, then I will forward these on to everybody so they can use them as references.
Absolutely.
Okay. And okay, we have a couple of hands. If you need to ask a question, I will ask you down at the bottom of your screen. You will see reactions. There's a logo down there on reactions. If it's not, go to the far right of all of those little icons down at the bottom of your screen and raise your hand. And I see a couple of them, so let me get to those now, and we'll
would it be
try
helpful, Jim, I'm sorry, I don't want to interrupt. Would it be helpful for me to stop screen sharing?
Yeah, if this is the last slide, yeah, we can eliminate that and just go right to the, there we go. There's our
all
group.
Right.
Hello to everybody. Okay, Michael, Hannah, how are you? And good morning. And what is your question?
Good morning to everybody. Really kind of two things. One, I wanted to say that thanks for last month's show, as it were, because I've contacted those lawyers and they're starting to work for me. So thank you for the information that Jim, that you provide for this monthly meeting. It's been very helpful. The second thing, of course, comes from the fact that this is an IBM group, and with that lawyers issue, there was the point that many of us may be able to apply for benefits because of our IBM, but that it would not be service related. And so I'm obviously one of those and wondering what amount of these lovely things that Jordan has shown us might yet be available to us if we were granted our IBM benefit. Would that qualify for any or all of these that started out by being said to be strictly service related? That's really my key question.
If somebody correct me if I'm wrong, but I believe if you have a if you have a service-connected disease and then there's any other developments that are related to that disease, they would also be covered. And I don't believe it would interfere with your eligibility or qualifications for these programs.
Yeah, but realize I'm one of those that.
Go ahead, Michael, you muted yourself there. Please unmute yourself. Yeah, Michael, can you unmute?
Got it. Okay.
There we go. Go.
Yeah, the real key is many of us with IBM have no service-related benefits whatsoever. We are not associated with VA by service-related activities. We're only part of getting benefit because of IBM. As was mentioned last month in the couple of folks that were talking about that. So if we do not have service-related, but are qualified for benefits through IBM, where do we stand in all these lovely systems that were being talked about?
Jordan, can you address that?
Yeah, I'll speak to that a little bit. And the work that Jim and many of the other advocates have been doing when it comes to IBM sounds as though it's been revolutionary and groundbreaking. And there's a lot of work that still needs to be done. As it stands currently, some of the VA programs that require that service-connected disability rating, for example, of 60% unemployable or 70% and more, if that service-connected requirement is there, you may run into a barrier if your IBM is not yet recognized as being service-connected. Now, if and when that changes, then those particular programs would be opened up. I don't know if that helps answer the question.
Yeah, those are the kind of things that we're going to be working on. This is what our battle has been, is to get everybody service connected for inclusion body myositis. And I know that service connection opens a great many doors, as you just indicated. So thank you for that answer. Howard Pink, you've had your hand raised. How are you?
I'm doing okay. Thank you very much. I was just curious on those fall buttons, the necklace or whatever. You said the VA provides for that. Do they also pay? I know has to be a phone charge or a connection charge to the emergency. Is that also covered?
Good question. And yes, that is covered through the VA. I've never had a veteran come back and say, I was charged. It's shipped to you, covered. And there are a few different kinds. There are some that require cellular service, some that require a landline. And there's one I learned of recently called a Liberty Medical Alert. And that's supposed to be the best one available. And that is available if you ask for it and someone isn't familiar with it. It's under the VA vendors list as FREEUS. I'll put that in the chart, in the chat. FREEUS.
And do we do that through our VSO or to our primary doctor at the VA?
Through your primary care doctor, and your social worker can help facilitate that as well.
Okay, because I use a fall watch, which is connected to my iPhone, but that other thing might be a little more beneficial.
Yeah.
Thank you.
You're welcome. Yeah, and there's bracelets and necklaces. So if you want to be able to just tuck it right into your shirt, you can.
Okay.
I have one, and it's just this little bitty thing that I keep in my pocket, and it if I fall down, I punch the button, it dials straight into 911. And I had to use it a couple of months ago, and they're out here in like 5 or 10 minutes.
Terry, did you get that through the VA?
So it's pretty nice.
Yeah, Terry,
you don't have to have any connection or anything.
Terry, did you get that through the VA?
I did.
Okay. So
my social worker came out and was asking me about it, and showed up in the mail, and it's really nice. You just stays in your pocket. You don't have to have a connection or anything. I've used it a couple of times. You push the button, they come on just like answering a number. Ah,
So anyway, if you're interested, talk to your VA
trying to get a
healthcare
phone call from my
provider.
daughter, and I can't hear. I'm sorry.
That's okay. So if anybody is interested in what Terry just shared with us, talk to your VA healthcare provider and inquire about that. Let them set you up with what's appropriate for you. Augie,
And
how are you?
Yeah, it's really nice.
Thank you,
Okay,
Jim.
Terry, thank you.
I have two questions. One is a follow-up to that fall pendant that the VA offers. I used to have one years ago, and then I got a notice from the VA that that item was being discontinued, and the VA was discontinuing that program. Is this something fairly recent that they have reinstated?
So how many years ago are we talking?
No, probably got that letter 5 years ago.
Okay. Yeah. And that was before my time.
Yes.
As is the case with the VA and the military, the only constant is change.
Just
and
change,
things are very
right.
fluid. So
Okay.
right now, there are quite a few different options available. So I would say give it another try.
Okay. The other question I have is in regards to that HISAP program.
Yes, sir.
Does the veteran need to own their home before that can be applied?
Good question. Yes. My understanding for any home modifications is that they either need to own their home, or there's an or, they get, if they're renting, they are given permission from the landlord or property manager to make those modifications.
Okay, but that can be done if the landlord is in agreement.
Is willing. That's my understanding.
Yes. Gotcha. Okay, good. Well, thank you very much, Jordan. I appreciate your program.
You're welcome.
Yeah, I had one comment that I'll share from a personal perspective. I inquired about that to get a ramp put in to the front entryway, and I wanted to do it to have concrete work done. The VA said they would do it, but if the VA did it, it must comply with ADA parameters. So the slope, the level of slope has to be within the ADA prescribed limits. However, my wife's landscaping is in the way of the bottom of that ramp, and we have really like our landscaping. Out here in the desert, they have what they call xeriscape, which is you don't plant grass, you use a lot of stones and decorative rocks, and it's costly. But we have that, and had we put in a ramp by the VA, it would have necessitated taking that out. So they said, though, if that grant they provide, which is the that allowance that Jordan described, if you take that and do it yourself, you do not necessarily have to stay within those ADA parameters. And we're going to use that to put a ramp in. So it's going to be at a little bit steeper grade that the wheelchair can handle quite comfortably. It's just another 12 inches or so shorter than what the ADA limits require. But doing it yourself, rather than having the VA do it, you hire your own contractors and you can put it in any way you wish. So just keep that in mind if that situation arises. Suds, how are things in Wisconsin?
They're great. Gentry had a question, but he didn't raise his hand. Gentry, can you unmute yourself, please?
Oh, I'm sorry. Gentry, I apologize. I didn't see you. I didn't see you waving at us.
There he goes.
Okay,
Gentry.
I just want to say I'm so glad to be here, to be in the support group meeting. And I call it the support group because that's what's important to me, is the support.
Indeed.
I was in the hospital for 2 months. You know, some of you may
You know, we've chat. I've been on this. I've been in a meeting a few times last year. I went to the hospital in April. I just got out. I got a bad infection. My wife's here, so my condition has changed. Where I used to use a cane and a walker, I can't do anything right now. And I'm a veteran, and I have a service connection. And it's just been very difficult. The VA, it's the system is just very difficult to navigate. Yes, there's a lot of good people. I've talked to my social worker, and I've talked to my PACT team and all that. And it's just my situation coming out of a intensive care, going into a what's it called? Where they where we was in the hospital for a few weeks, ICU, and then going into a nursing home for a while. And I just wanted to get home, and then coming home, and my wife has to take care of me. I can't do anything for myself. I'm just now kind of sitting up in a chair, but it's not a lift chair. So I'm going to have my son is going to have to help me get back into the bed. This is my first time, and I'm just sharing this with you guys. Some of you know about this kind of stuff. I've heard about it, but now I'm experiencing it. I have to have a bed, a medical bed. And it was very difficult when I first got out of nursing home. I was on the floor for several days. So the support group is just so important to me. I haven't talked to anybody in months.
Jordan or Gentry, I will tell you that we've all had our issues at one time or another. Your sounds, Gentry, like it's certainly a bit more advanced than the rest of us have. But if you need any help, guidance, support, you've got my email. My phone number is floating around all over the world, so that's not hard to find, but you've got my email. You use it. If I can't get you directly connected to the person that you need to connect to, then I'll reach out to others and get that done for you. So by all means, what I will tell you right now is do not feel alone. There are 100 of us at any one time available that have gone through things like this, and we can help you. So please don't feel alone. I'm glad you're here. This is what we're here for. And you don't hesitate to call me. Well, we got something happened here. I apologize here. My screen just
Richard Lawler. Richard, you have to stop screen sharing here.
It's Roland Lawler.
Roland Lawler.
Okay.
One thing I will add to that, Mr. Gentry, thank you for sharing. And to all of you, I haven't shared yet, but thank you for your time and your sacrifices that you've made to our country. I would say, if you have not already, I know you said you've met with your PACT social worker, but if it's difficult for you to physically go in and set up another meeting with him or her, ask to have a video appointment, a VVC. Sometimes that's easier to be able to connect more personally, face to face, and see what additional support can be put in place for not only you, but for your wife, and kind of walk with you through some of these recent changes.
Yeah, Gentry, if like I said, you have my email address. Please let me know what we can do to help you and to get whatever help you need, either from all of us collectively or through the VA. We'll do our very best to help you with that. So I'm glad you're here.
Just let you know.
Yeah, don't be a stranger. Don't be shy. Pick up the phone, email me. We'll get it squared away.
Okay,
hey,
great.
Jim, could I step in here and assist Mr. Butler with some information right quick?
And that's exactly what we're here for, Kevin. So please do so.
Okay, Mr. Butler, what I would like you to do is I would like you to write down the following phone number. and call me direct, 540 645 8293. And the reason why I would like for you to call me is because you and I are both in the same situation. The VA needs to get you a wheelchair, but getting you a wheelchair is not easy. The first thing they have to do is they have to take all of your specifications, get all of your specifications written down, and then they would submit those specifications to what is it called, Lori? The organization that does the wheelchairs. No, down at the VA.
Yeah,
anyways.
Prosthetics. Yeah, prosthetics.
Yeah, prosthetics. So not
Prosthetics.
only do you need to do that, there's also the ability to have you interviewed and evaluated to have a lift installed at your location. I am living proof that the VA can help you so long as you dot all of the I's and cross all of the T's with physical and occupational therapy. When I submitted my packet to the VA back in 2020, I had a 24-page document that had all of the specifications. I was issued a wheelchair within 2 weeks. I still have that wheelchair. They tune it up from time to time, change the battery. But the bottom line up front, sir, is you need to have one of those quantum 3 eye-level wheelchairs that allow you to have the independence to live a life where you can raise, you can lower, you can raise your feet, and also, too, to have them look into getting you a lift. So if you can call me direct, I can give you some direct guidance on what you need to do. And I can also clue in my wife, my caregiver, to help you and your family get what you need. Over.
Kevin,
Yeah,
thank you very much.
I want to know your name. What's your name?
My name is Kevin Donahue.
Kevin, okay.
And I'm a relatively young person. I just turned 61 a couple of weeks ago, and I'm basically to the point where I can't get out of my own way. My caregiver takes care of me 24/7. She does everything for me. I just filed a claim with the VA about 2 weeks ago to be considered for service connectivity for IBM. But even having said that, I don't have IBM. I'm a veteran that has mobility challenges. I've served my country, so they can outfit you with a wheelchair. They can also outfit you with the lift. And there's ways to go about doing that sooner rather than later. So we can have a conversation later, sir. We definitely need to get you some help. I've been helped. You can be helped. We can all be helped. We can help each other. Over.
Yeah, Gentry, one of the to my own experience, what Kevin said is going to be very useful for you. But in my own experience, I just went to my doctor and said, I need a wheelchair. He knew my condition. I just said, I need a wheelchair to lift up. Within a week, I got a call from the physical therapy department from prosthetics. They had me come down. They measured me. It was one of the easiest things that I've ever gone through. So if your doctor is willing to get that prescription, I think you're going to be taken care of. But don't delay in doing that, Gentry, because apparently you need this wheelchair and the VA can get it for you. Howard, you had your hand up again. Can we help you?
I had a follow-up to the house renovations that need to be done. Now, I'm not married, but I've been living with a lady for 19 years. She owns the house, and we've put in chair lifts in the garage, kitchen to the garage, and first floor to second floor. But I'm just wondering, would I qualify, being that I'm not married and I don't own the home? I sort of pay her, an amount of money every month for utilities and food and gas and things like that. And I'm wondering if that qualifies for my being able to get some other home improvements done to help me with my mobility issues.
I don't foresee, just from the outside looking in, that there would be an issue with that. If anything, perhaps your partner could just provide consent that she's okay with having certain things done to the home. I don't see that being an issue. With that said, for any of you, if you're not sure if you qualify, don't let that stop you from asking.
Okay, thanks.
Okay. Dennis, good morning. How are you doing, Dennis?
I'm good. Can you hear me?
We can hear you fine.
Yeah, I'm fine. I have two questions. The VA's given me a little hard time with PT. Now, we all know that we're not going to get better, but we try to stay the same. And this PT guy tells me, well, the VA doesn't pay for maintenance. I mean, then, then I have to go out on my own to get PT. I mean,
that's absolutely not correct. That's absolutely not valid. The Veterans Administration has physical therapy. It is available to you. There's no question about that whatsoever. If your doctor prescribes it, it's going to be there for you.
Well, I have been going, and they said, well, you plateaued. And I said, yeah, I plateaued. That means I'm staying the same, which means that's good. So, but we don't do maintenance. So he wouldn't give me any more PT. Does that sound right?
No, it doesn't. I would go back to your doctor and share that information with your doctor and tell him that you need to continue with physical therapy in whatever way, shape, or form that he prescribes. And that the one thing I think that is so very critical in this is that there are so many people within the VA hospital. Let me rephrase that. There are so few people within the VA medical care system that are unfamiliar with inclusion body myositis and all of its characteristics. As such, they try to treat us like any physical therapist. Come on, the harder you work, the better your muscles are going to be. No, that doesn't work with us. No. And this is something that you've got to share with your doctor to let them know that you need continuation. So indeed, take that up with your doctor and explain that to them.
I did that, and she looked at me like, what? She couldn't pull it. She's been away on maternity leave, so we keep getting different people all the time. So when I went in there the other day, I told her that, and she goes, really? Well, and then she put in, well, I'm putting you in for PT. So now I just have to wait and see what happens.
Yeah, if the doctor prescribes it, you're going to get it. And the thing is, they'll be they're not going to deny you the help that you need.
Okay.
And Mr. McKinney, too, if you haven't already, it's worth speaking to your social worker. He or she can advocate for you to the extent that they're able, and speak about the need for PT for quality of life.
Right.
Also, when we're talking about PT, you want to make sure you're communicating. I am worried about falling.
Well, I just fell twice, so it's not good. Right. But when I told him that, he looks at me. He said, "Well, we don't." And he even talked to the PT girl. He said, "Well, he's plateaued, so we don't do maintenance.
And
so we need to do it at home." And my wife's not strong enough if I fall. So
that is clearly an indication that they are not familiar with inclusion body myositis. So again, take it up with your doctor, as Jordan suggested. If that doesn't work, get the social workers involved, and you'll get the help you need.
All right, I appreciate it. Thank you for that nice meeting you gave to us.
Thank you. Any other questions? I see Dennis McKinney. I don't think. Oh, that's you. Okay, I'm sorry. Yeah, I just saw the name. Any other questions? Suds, you got your hand up.
Yeah, one for Jordan, real quick. SHA grant versus the HISA grant. Specially adapted housing grant versus the HISA grant. What's the difference between the two? Jordan, I can't hear you.
Jordan, we're having difficult hearing you. Jordan, could you turn your, we can't hear you very well, Jordan.
I can't hear.
Jordan, can anybody hear? I
No.
can't hear her. Jordan, can you hear me?
She's talking like she's muted.
Jordan, we're having difficulty hearing you. Can you try your microphone again, please? Jordan, she can't hear us either, apparently.
I got a closed caption warning on my screen, so she
Yeah,
may be set up for closed captioning.
I saw the
got
same
it.
thing.
She left the meeting.
No. Let me try asking her to unmute here.
No.
Jordan, can you hear us? Okay, apparently there are technical difficulties, certainly beyond my control. I don't have a 12-year-old close by, so we're going to have to deal with this ourselves. Okay, we have, let's see, Tierney Mayor Tucker up with your hand raised there. We can see you somewhat right there. How are you?
Hanging in there. Just on the physical therapy, what I ended up having to do is going through community care. And then I basically, because I had an active congressional complaint, got them to go back and backdate basically the community physical therapy that I was doing. So that may be another option if they're running, if getting, sorry, my cognition issues are getting in, if they're getting any kind of pushback from the VA. My primary said I needed it, my neurologist said I needed it, and because of my history with the VA, I didn't want to go to the VA because of that trust isn't there. And so I just went out to a community provider, and they're great. They didn't know about IBM, but they've all studied up on it. So I would suggest trying that.
I'm not sure that I understood your question there.
No, just a comment for forgot the name, the gentleman that was having whose VA physical therapist said that they don't do, or the VA doesn't do maintenance.
Oh, okay. Yes. Yeah. It's something, again, I would strongly suggest that anybody who encounters that situation to take that up with their doctor. They'll get it squared away, most definitely. Bruce, you have your hand up there. How are you?
Yeah, I just for SUDS, the difference between HISA and the other grant that he was talking about is monetary amount. The HISA is limited to $6,000 some odd dollars. The other one is in the $50,000 bracket, but you have to be service-connected, disabled, with the disability being service-connected. So until we get service-connected disability for IBM, we're not eligible for the other grant, the big dollar grant.
Well, I know that Larry, if you wouldn't mind, could you share your information with everybody about the amount that they shared with you about how much is available for your home improvements?
Yeah, actually, I have, excuse me. I have service connection, 100%, and my housing grant is 117,000. And that varies year to year because if the cost of living goes up, so goes the grant. You can use it 6 times or until the money runs out. So you don't have to use it all at one time. You could put in, if you qualify, you could put in a whole house generator system for around 20,000. And then down the road, you could put in a ramp or whatever you may need. As long as you don't exceed 6 times or the money.
Now, Larry, I know that your disability has qualified you for an advanced disability compensation because you're on that the R1 rating.
No, actually, I'm on R2 now.
Is the rating now? Does that increase the amount of that grant, or is that grant the same for everyone?
That grant's the same for everybody.
Okay, there you have it. So check with your own healthcare system, because as we have been told that when you talk to one VA hospital, you're talking to one VA hospital. Apparently, these programs vary throughout the country. So what is available through one facility may not be available to everybody. But so indeed, check it out. I know my wife and I have been talking for some time, and we just yesterday finished the installation of our whole house backup generator. I initiated this without even knowing that the VA may have provided that, but I will absorb that expense myself now. These are all these things to keep in mind. And Jordan, with the aid and attendance, the home health aides, the skilled nursing services, the durable medical equipment, respite care, HISA, these programs have been, these are the kind of things that we
Hang on a
need,
second, Jim.
that we needed to get information on, and we're so very grateful
You
for
got
you
it all
that
checked
could-
out? You're on your way? Hey,
provided for us.
shutting off the meeting, so I'm all done with it.
I'm sorry, we got a hot mic there. I had to mute that. But we're very grateful for your time and your presentation on this. I will touch base with you, and I will tell everybody that Jordan is here due to the benefits of Alicia Lowther. Alicia reached out to her local VA facility, and they put her in touch with Jordan, and through that is why Jordan is here today. And again, we're so very grateful. Before we leave, are there any other questions? We're about out of time, so just wanted to make that available. Does anybody else have any further questions? If not, I'm going to bid everybody a wonderful Saturday, healthy, safe. Take care of yourselves. Jordan, again, thank you endlessly for all of your contributions and your time with us today.
I have a quick suggestion for some people.
Carl, go ahead.
If you can get the provider's booklet from the society, that is most helpful in giving information on IBM to physicians around you and stuff. The other thing is, at least my VA hospital has a mobility clinic that if you have mobility problems, you can contact them and get assistance.
Carl, thank you. All of those good points. Talk to these people at the VA. They are there to help you. Again, you've got my email address. Use it. We will do everything we can collectively to help you out. To all of you, thank you. God bless. Thanks for your service. And we will talk to you next month. Be well all.